Hi, I'm Amy. I'm guessing you're here because you're researching gallbladder issues. I am here because I have been having what has recently been diagnosed as gallbladder issues for about the last 2 months, and was very surprised at the lack of people who had come forward in a vlog to talk about what was going on. I saw lots of blogs about it and lots of medical references that sort of gave the same information over and over again, but not really anybody who was showing you their face and talking about their symptoms and what they were experiencing. So here I am. Like I said, my name is Amy. I am 29 years old. I started having some pain in my side about 2 months ago with some nausea, and I'm going to stand up and show you where it was hurting me. I'm not a skinny girl, but my pain, this is my right side. This would be the middle of my chest. My pain is right about here. Sometimes I will get some pain here, but usually it's located here. Sometimes it'll radiate around back to my back. Well, painful to the touch. I think initially it was right after meals. And when I say right after meals, it wasn't like immediately. It was within about 10 minutes, and it would last, the pain would last anywhere from 10 minutes to a couple of hours. And then it got to the point where I always had some sort of dull ache in my side all the time. I would have nausea immediately after eating. And that would last for no more than 30 minutes. In the last 2 months, I've woken up twice in the night with abdominal bloating, pain, like just an ache, a feeling like if I could just burp or pass gas or do something or pace and move things around, that it would feel better, but nothing relieved it, not antacids, not anything. So I went to the doctor. He said, I think it's your gallbladder. And I wanted to make sure because I also have irritable bowel syndrome, IBS, and I've sort of been living with a progression of symptoms for the last 10 years that are related to that. And so I sort of just thought that maybe this was a progression of my IBS. And he said, well, let's go get an ultrasound. About 3 weeks into my problems, I had an ultrasound that came back negative for thickening of the gallbladder wall, which would possibly indicate infection, and it came back negative for gallstones. And so my doctor said, I really feel like it's your gallbladder, so let's go get a HIDA scan. And a HIDA scan is they visualize the liver and the gallbladder and then give you an injection of radioactive material, which filters through your bloodstream and into your liver and then processes out into your gallbladder as bile. And then they inject you with something called CCK, which makes your gallbladder constrict. And then over the next 15 to 30 minutes, depending on how well your gallbladder is functioning, they watch your gallbladder and they measure how much it is squeezing and how much radioactive material is leaving your gallbladder. My ejection fraction was 28%. Low is like 35 to 50%. Abnormal is anything below 30 or 35%. So mine was still on the higher range, but was abnormally low. So I met with a surgeon yesterday, and he told me that he wants to take my gallbladder out. Yay! I'm going to have my gallbladder taken out Monday, November the 28th, and I will take you guys on that journey with me and hopefully be able to be a resource for you and answer any questions along the way that you might have about